Welcome back at 6:42. The hard truth is many of our fellow Hoosiers have cancer, and every day many of them are forced to choose between getting their medicine and treatment and keeping a roof over their head. Well, now you have the chance to help these fighters focus on living and not their living expenses. And to talk about that and more, I'm honored to have one of my own oncologists, Dr. Remu Bir-Haray with Hematology Oncology of Indiana. I just love you.
Thank you.
Thank you for
I
being
love you
here.
Too, so that makes it mutual.
Now I want to talk a little bit about you because I've been thinking about how incredible it is that we even ended up meeting. He grew up during the Nigerian Civil War, and then in medical school in Nigeria, you actually wanted to be a psychiatrist,
Yes,
came
I did.
to America for residency, fell in love with oncology, and turns out they're pretty related.
Yes.
Can you talk about how vital it is for patients to be able to focus on fighting for their life?
It's so vital because think about it, Lindy. If you are going to spend your time receiving very toxic chemicals, but at the same time you're wondering, how am I going to live? How am I going to pay my rent? How am I going to take care of my day-to-day needs? Your life doesn't end because someone is diagnosed with cancer. Our goal is to go beyond the chemotherapy and the treatment. So it's very important that we provide assistance to those people who are not able to afford it. We have a lot of Hoosiers who unfortunately cannot pay their rent, who unfortunately cannot get to their doctor's office. Our goal is to make that not a thing. Our goal is to make sure that everyone has access to care, access to health, so that people can live. That is our purpose.
I mean, I've seen people have to leave the pharmacy and stuff. My husband saw a woman whose husband was sick, and she was able to buy one pill for the next day.
Think about that.
It just breaks your heart.
Yes.
There are ways that you can help, and so you're doing this inaugural event this year, Sapphires and Speedways. Even if you can't come, we'll talk about some ways you can help, but tell us about it.
So the Sapphires and Speedway event is the first time we're doing this through the American Oncology Cares Foundation. This is a nonprofit. Our goal is to raise money. And how are we going to do that? There'll be a silent auction. There are tables. We need sponsors. People need to pay for those tables so that the money that we raise can be used for Hoosiers like you and I, or people who can't afford the care that they need. Silent auction. We want people to come and buy things.
Yeah.
We want people to buy tables. We want people to contribute. You don't have to be a patient of our practice to receive benefits from this foundation.
And it's even very flexible, being the first one, just trying to get it going. Maybe you just want to sponsor 2 seats, and someone can go. There are ways to be creative with sponsorship.
Yes.
I do want to, and there are individual tickets. I want to pull up this photo. And you're going to think it's me and you probably, but it's not. It's you and your mom and your sister.
Yes.
In Nigeria, right?
Yes. That's
and look, you've
Nigeria.
always dressed well. What do you remember? Do you remember that day?
Yes, I remember getting dressed up for the photo, and also just the fact that my mom was there, and I grew up as a mama's boy, and that was always my life. My dad was there. My dad was great, but there was that special bond with mama.
Wow. And when I saw that you were going to go into the mental side, it made total sense to me, and also connects to all of this.
Yes, it does. It does.
Anything else you want people to know?
You do not have to be a patient of our practice to contribute. You can contribute in any way you can. You can simply donate to the American Oncology Cares Foundation. You can buy a table. We want everyone to come to this table of brotherly love so that we can help everyone who needs help.
I'll be emceeing, looking forward to that. I've actually done a past story with Dr. Bir-Haray about diversity in clinical trials that's really interesting. You can check out on our web. In 3 weeks, I'm 4 years out from diagnosis.
Thanks be to God.
Thank you.
Amen. Amen.
Well, we'll have this on our website a lot more. Appreciate you coming in.
Thank you.